Uh-oh, it seems that Julian has come down with a bad case of fatal leukemia. Can you show me how to give him a life-saving bone marrow stem cell transplant?
Surely
Of course not. You can't, because you haven't watched this video on what happens during a bone marrow stem cell transplant.
Hero, is this legal?
Cash, come here. This is our trusty volunteer, Cash. He's going to be the patient we're taking stem cells from. Now, stem cell donation is difficult, but don't worry. We aren't licensed medical professionals, so we can't be held accountable. Okay, Cash, you're gonna lie down on this pillow. In a typical operation, you would...
Then. If you are a donor, you may be wondering why you need to do all this. It's because you are gonna save someone's life. Stem cell donations are employed after the patient undergoes cancer treatments, typically chemotherapy, to replace the cells destroyed during the process. Chemotherapy and other leukemia treatments work by eliminating dividing cells. Cancer cells, which divide at extreme rates, are hit very hard by this. However, stem cell donation is used to replace the stem cells eliminated by chemotherapy.
Now, in a normal operation, you would be thoroughly reviewed and your medical history checked. But we don't do that at these studios, which is why this guy here is our little test subject.
You get blood tests, disease tests, HLA matches will all be tested. Once cleared, you will be taken to a special room where you'll be put out with anesthesia, and a breathing tube will be inserted into your throat.
A doctor will repeatedly stab a needle into your hip bone, hoping to find bone marrow like an 1840s prospector hoping to make it big, striking gold. 1 to 2 pints of liquid bone marrow will be extracted through a tube out of your body, about 10% of all bone marrow. Sometimes, they will even take red blood cells, but don't worry. Licensed medical professionals will return these cells later.
Full surgery takes about an hour, and you won't be able to drive home afterwards. You instead need to wait in a recovery room while you heal from the effects of the anesthesia and the loss of 10% of your body's entire bone marrow. You get an IV to replace the blood that was taken, and you should recover in about another hour.
Side effects include, but are not limited to, nerve damage, exhaustion, nausea, sore throat from where we shove the tube down, a potential infection in your hip, risk of graft versus host disease, excessive bleeding, spider best efforts, or a risk of recovery where walking, running, or otherwise using your hips can be painful, lower back pain, or lower count in your blood. If you experience excessive fatigue, bleeding, or infection, contact a doctor immediately.
Now that you have a rough introduction into the whole procedure, why exactly, very specifically, do we need to donate bone marrow stem cells? Well, cells work in funny ways. They all start from a single cell called a stem cell. Most stem cells are found in the bone marrow. These are known as blasts. Stem cells over time become all of the other cells in the body through a process known as differentiation, which is essentially different genes activating to make the cell more specialized to a specific job. However, leukemia targets the blast cells in the bone marrow, infecting them and causing them to not undergo differentiation. This means that there are cancerous blast cells in the bloodstream, and fewer red blood cells, white blood cells, and platelets to take care of the body. The immune system becomes compromised and the body isn't producing enough blood cells to compensate. Chemotherapy is employed to kill the cancerous blood cells, but the functioning stem cells in the bone marrow become collateral damage. The patient then needs new stem cells.
And we get these from bone marrow donors who donate their stem cell-rich marrow.
But not everyone can become a stem cell donor. Many steps and processes need to be taken into consideration. To start, you should contact your primary medical provider.
So not us.
And ask them about the process. You can do this an in-person genetic sample or register online and send in a sample. Because of the genetic complexity of matching donors to patients, it could be a few months or many years before you match to a patient.
However, you are not allowed to save a life in person if you are under 18 or over 44. People over 44 have to donate online.
And only if you live somewhere in America. You'll also be screened for these diseases.